Well, the IFRC has mobilized thousands of volunteers and workers all over Sudan to support people in a lot of areas with evacuations, family reunification, first aid, psychological support. How would you say aid deliveries have been so far? Are they sufficient? I mean, you're saying a lot more resources are needed, right?
Yeah, you're absolutely right. The Sudanese Red Crescent, together with the Red Cross Red Crescent movement, including colleagues from what we call the Swedish Red Cross, Swiss Red Cross, Netherlands, have over time invested a lot in building the capacity of the communities that are vulnerable to disasters. So you have in the community people that are trained in provision of water and how to purify water. You have health workers, you have disaster managers, you have psychosocial teams that are on the ground. So I would say the humanitarian situation right now is there. The resources are small, but it's being shared out. But this is where we are actually highlighting and profiling the need to mobilize more resources for the people to be able to meet their basic needs.
What would you say that your teams need most right now?
At the moment, we are looking at provision of food, and because the next rain season is expected in the next couple of months. So you have to put at least 3 months after that rain season to be able to do any meaningful harvest with the war that has been disrupted. So we are talking about a rainy season that is coming, and there will be very little farm activities to be able to produce food. You're looking at a coming rain season that will cause flooding, and flooding comes with displacement of population, increased health challenges because of waterborne diseases, communicable diseases. You're talking about provision of shelter and additional shelter for the people that will be displaced and that are displaced. So it's a mixture of food, it's a mixture of health services that are required in terms of medical supplies, in terms of support for the health workers to be able to move, provide medical mobile services. You're looking at water purification and ensuring that water is accessed and clean, potable water is accessed by the communities.
Are there areas in Sudan that are particularly hard to reach but is also in dire need of aid?
Yes, this includes the capital city of Khartoum. This includes now places like Gadaref, where there are large population of people displaced. But there are also others like Darfur, where because of the conflict, then access becomes a challenge. This also includes Kordofan region. So there are areas that are actually experiencing active fighting. There are areas that have received IDPs, and the areas that are also a bit far away from the war that are providing support to people who are displaced. So it's a mixture of people directly in the conflict area and people receiving IDPs. That would be Gadaref, in Kassala, in River Nile states. So you have a mixture of the actual fighting areas and others areas that are receiving people.